Welcome back in. We have Dr. Danny Avula in studio answering your questions about anything on your mind when it comes to COVID, the vaccines, testing. So happy to have him in here. And I know, Kurt, you had some questions as well.
Well, I have a question from Amy, who is a kindergarten teacher in Chesterfield, and she says that many of the parents that she sees every day with those kids, obviously they're 5 years old and they qualify for a shot, but there's so much apprehension. What can you say that would ease the fears of the parent of a 5-year-old?
Yeah, I totally get it. We've had about 29% uptake in that 5 to 11 category, a lot lower than what we would have expected at this point. And, you know, the reality is that severe disease from COVID is going to be pretty rare in young kids, but not non-existent. We have had 10 pediatric deaths since the beginning of this pandemic. The vaccines have just been shown to be so safe in this population and so effective against severe disease that the risk-benefit calculation really leans towards let's get the vaccine and make sure our kids are protected.
We had a question from David Goldberg, who is appreciative that VDH has partnered with a number of libraries throughout the state to offer those at-home testing kits, which are running out pretty quickly. He wants to know, will they be partnering up to offer quality masks, KN95 masks? Will there be more materials that people can get?
Well, the federal government just announced today that they are mobilizing hundreds of millions of masks and other types of PPE. So we are waiting to hear what will come to Virginia and figuring out where best to deploy that to make sure people who need it can get it.
Do you see a time where we will go back to these mass vaccination clinics like out at the Raceway and other places? Or have we reached a point where many practices, maybe my family practitioner, will have the vaccine that I need or the booster that I need?
Well, both of those things are true right now. We've really prioritized making sure that private doctors' offices, pharmacies, and other types of practices have access to the vaccine. We have over 2,700 providers throughout the state. But we are also offering the vaccine through these large mass vaccination centers. Right now, there are 9 active sites in the big population centers across the state. And that's filling a big need right now, especially as we see the demand for vaccine increase in the face of Omicron.
For those who do plan to get a booster, Dr. Avula, we know J&J, there are some concerns about rare blood clots that can be the result of this vaccine. Are there plans to pull it off the market, or what's the future of that J&J vaccine? What should people do?
Well, it will be pulled off the market. I mean, the CDC's recent review of the data this past week just said, you know, even though it's still a rare side effect, these blood clots with Johnson & Johnson, it's still safe for use. What they said is that the Moderna and Pfizer are better options. And so people will continue to be encouraged to preferentially choose the Moderna and Pfizer over Johnson & Johnson, but it'll still be available for folks who may be allergic to the Moderna and Pfizer, or may just want it for any reason.
Now, for the past 3 days, TSA agents have screened 2 million people a day. And if somebody sees these numbers going up and maybe they're traveling, getting on a plane the day before Christmas or maybe over New Year's, what advice do you have for them?
Yeah, I think this is going to be the case through much of the country. We've now seen that Omicron is the dominant strain, 73% of the cases. We're seeing cases surge almost in every part of the country right now. So as people prepare for that, I think really doing the things that we know work. If you haven't been vaccinated, get vaccinated. If you've been vaccinated and are now eligible for a booster, get boosted. As you go into public spaces, wear a mask. And if you're going to gather with people, I would really recommend getting a test before and during and after those engagements.
And Dr. Avula, just what message do you have for those? You know, there's still people out here who are not vaccinated. And, you know, one of the responses I've heard is, well, people who are vaccinated are still getting the coronavirus. What message do you have for those who just still don't have a lot of faith in this vaccine?
Yeah, it's absolutely true that even people who are fully vaccinated and boosted are still getting infected. This Omicron variant is so contagious, it's evading the vaccines. But what we've seen with Delta and what we've seen so far with Omicron is that when you contract that virus, you are much less likely to get hospitalized or to die because of it. So vaccines still play an incredibly important role. In fact, the most important role in terms of preventing against the severe consequences of this disease. And I'd much rather meet that virus vaccinated than not.
All right, good advice. Dr. Avula, thanks for joining us today. We're back right after this.